I'm Dr. Hera Farzok. I'm an OB/GYN physician. This is my YouTube channel for women health and awareness. So if you find these videos helpful, please like, subscribe, and share as much as you can so that most of the women can get benefit out of it. Today, the topic of discussion is 5 warning signs in the last trimester of pregnancy. Now, keeping this discussion very short and to the point, I just want to say that most of the women, when they are pregnant first time, that are the primigravidas, or the women who are experiencing these symptoms for the first time, they don't know or they don't have an idea that how serious these signs and symptoms are. So if you feel any of these, just rush immediately to your nearest hospital or the doctor to which you are going for the antenatal visits. So let's get started. Sign number 1 is decreased fetal movement. If you feel that the baby kicks are less means less than 10 in 2 hours. If you are fully hydrated, you feel that you have eaten well and you have consumed water according to your body demand, but still the baby kicks are slow or you cannot feel them, rush immediately to the nearest hospital or your consulting physician. Get a CTG done so that you can be sure that everything is okay. Point number 2 is if you feel severe headache, blurred vision, or even swelling on your face or legs, just rush immediately to your nearest hospital. Don't try to manage these symptoms at home with your remedies. It's not good for you and not for your baby. Point number 3 is if you feel that your abdomen is contracting, that means you have labor pain. So if your pain increases and you feel that contraction again and again, like 3 contractions or with short intervals of time, you should go immediately to your nearest hospital, get your pelvic examination done, and see if you are in labor or not. Point number 4, if you have leaking. Now leaking, sometimes the patient is experiencing leaking but they don't have the idea. It is like a gush of fluid, like you are passing urine, a lot of amount of urine. When you feel that like your trouser is wet, you just rush immediately to the hospital. This is one of the most important warning sign which you should not ignore. And point number 5, if you feel any sort of bleeding, whether it's less or more. In the last trimester, you cannot say that I can manage it at home. I will just stay and see what happens. My baby is fine. I can feel the kick, so no need to go to hospital. No. If you have bleeding, you should rush immediately to your nearest hospital. These are the 5 most important warning signs that you should not ignore. This is not good for you and for your baby. So you should not ignore them and rush immediately to your nearest hospital. I hope you find this video helpful. If you like this video, please like, share, and subscribe, and share as much as you can so that most of the women can get benefit out.